skills, and much more that we need as we go through life. So we are privileged this day to have our first session for this semester. And I've seen our facilitator is already in. I don't know, there was another meeting still engaging our VC and DVC. I believe they were supposed to be in. But that said, maybe as they join, I'll just take us through how the day will be. Of course, we'll start with the actual session. This session will also allow for time to react with our facilitator in case there will be questions and answers at the end of the session. Yeah, so feel free, those who have joined us, feel free to interact with our facilitator. I know that she is bringing in a topic that is of concern to many of us. So let us be ready to learn out of this particular lecture that we are having this afternoon. Yeah, so I'll welcome us all, and maybe before we proceed any further, I don't know whether I'll be inviting the Dean of Students shortly, Mr. Moses Leseo, if you are in, so that you usher in our speaker of the day, so that she takes over the session. Welcome, Moses.
Thank you. Thank you so much, Evans, for that. And ladies and gentlemen, it's my pleasure to introduce you to our distinguished speaker for today. That's Miss Esther Munguti. And basically, we find she's a psychologist and committed mental health advocate with extensive experience supporting individuals in organizations across Kenya. So she has specialized in addiction treatment as well as rehabilitation using evidence-based approaches such as cognitive behavioral therapy and trauma-informed care. So passionate about prevention, Esther leads a workplace wellness program and the public sensitization efforts aimed to reducing stigma and promoting early mental health interventions. So with this strong foundation in gender studies, she integrates an inclusive perspective to our work and highlighting a relationship between gender and mental health. So today she'll be sharing her insights on suicide awareness, building hope, and breaking stigma and challenging the narrative, a topic of critical importance for our community as a university, together with our students and staff. Kindly please join me welcoming Miss Esther Munguti. You can give her some emojis. Thank you so much, Esther. Karibu sana. You can proceed.
Kindly, Moses, confirm that you can hear me.
Yes, loud and clear.
Okay, thank you so much. I really appreciate that introduction. So I'm just gonna bring us to our topic today due to the course of time. So as you have heard, my name is Esther, and I'm really, really thankful for being able to facilitate this important session on suicide and suicide prevention. And one thing we have to understand is that today's discussion will be focusing on understanding one of the most sensitive yet very critical issues affecting our communities, especially within the university environs where both students and staff can be challenged in one way or the other in terms of academic, professional, and personal pressures. So before I can continue, I hope you can all see my screen and kindly confirm that the slides are moving from your side.
Yes, Esther, they are moving.
Okay, thank you so much. So suicide is not just an individual tragedy. That is one thing that we have to understand. It's a public health concern that leaves a lasting effect on our families, our peers, and institutions. And as we engage today, our goal is to increase awareness, break the silence surrounding suicide, and promote a culture of empathy, openness, and timely support. And before I can dive into our first slide, I want us to understand that every year, more than 700,000 people die by suicide worldwide. And this is according to a research that was done by the World Health Organization in 2021. This means that there is one death by suicide every 11 minutes. And we can see that is massive loss. And in Kenya, without now looking at the world, in Kenya, suicide rates have been rising steadily, particularly among the youthful population, especially among the male gender. And according to also another study that was done by the World Health Organization in 2019, Kenya has an age standardized suicide rate of 11 per 100,000 people, which approximately shows that we have 4 deaths by suicide on a daily basis. And let's imagine this is just the number that is normally given to us. What about those numbers that are not reported? So what number do we have in a day of suicide cases? You might find that it's more than 4. And rising cases, particularly among young men, are driven by mental health gaps, economic hardships, and stigma. And I'm not only specializing on the male gender, so msini kujie. And so that is just on a light note. So these are just not numbers. These are families, communities, futures cut short, underscoring the urgent need for talk about non-suicidal injury. What do we mean? And this is the intentional, self-inflicted harm to one's body without the intention to die. And we have seen people cut their wrists, cut their, their legs. They don't intend to die, but they are trying to, to inflict that pain that they are feeling, emotional pain. They are trying to make it physical so that it can heal. That is normally the intention. Nikijikata, by the end of the week, at the end of the month, nitakuwa nimepona, and whatever I'm feeling inside, itaisha. So we can look at non-suicidal self-injury, things like cutting, burning yourself, scratching, hitting oneself. We may find that some people end up even banging their heads or kupiga ukuta ngumi, interfering with wound healing, though it's very rare. Substance misuse or the deliberate starvation. In some cases, some people might decide, oh, sikuli, maybe due to, let's say, for example, a student has experienced academic failure in two subsequent semesters. They may decide, nimekuwa nikifail, ebu nijipunish nisikule. They don't have the intention to die, but they are punishing themselves. They are inflicting some sort of punishment on themselves. And then when we look at suicidal ideations, what do we mean? These are the thoughts about ending one's life, which can range from fleeting ideas to detailed plans, as we have seen in the last slide that we have just talked about. And we have 2 types of ideations when we talk about suicidal ideations. We have the passive ideation, which is one wishing to be dead without specific plans. They haven't planned to die, but they can say things like, I wish I couldn't wake up tomorrow. Si ati anaamua kujua, ama they have a planned out plan on how to take their lives, but they don't wish to be alive anymore. And then we have the active ideation. And this is where someone thinks actively about suicide with the intent and, having those possible methods to execute the plan. For example, I have been thinking about taking poison, have been thinking of hanging myself, and things like that. So that is active ideation. And in most cases, you find that active ideation is the one that leads to the actual act of dying by suicide itself. And then what are these possible triggers? But I'll talk about them when we get there when we get to the slide of risk factors. So looking at suicide attempts, what do we mean by suicide attempts? Suicide attempt, this is the act of self-injury that is normally carried out when at least someone has the intention to die, but the person survives. Maybe they were saved. Maybe the plan didn't go as they had planned. Maybe they bought the poison and somehow someone called, I'm visiting you in the evening. And they decided, acha ni postpone hii kitu nisifanye leo, and things like that. So they ended up being saved. They didn't finish up. Mtu akaenda akampata, and then they found them in a critical condition, akapelekwa hospitali, akapona. So that is what we mean when we talk about suicide attempt. And then on the next slide, we are going to look at the stigmas that are normally associated with suicide. I know we have looked at, suicide we have looked at the public stigma the cultural beliefs that have been there. But what are other stigmas apart from the public stigma that we normally talk about, because that is the most common one that we talk about? But we have other stigmas as outlined on the slide. And then we have internalized or self-stigma. And where does it come from? Where does it crop from? And this normally occurs when individuals who have suicidal thoughts or have attempted suicide or maybe lost someone to suicide, they begin to accept and believe the negative attitudes or the negative things that have been said by the society or other people regarding or surrounding suicide. Unapata mtu kwenye maybe alijaribu and then they survived, or maybe it's you ulijaribu na ukasurvive, but people maybe have told you, you're being selfish, you are just seeking attention. Alafu hiyo stigma inaingia kwa akili yako until it becomes self-internalized. Maybe even not there is no person that talked about it, but wewe mwenyewe ukikaa hivi you start feeling it, iko ndani kwa ndani. And then we look at public stigma, and this normally crops from maybe cultural myths, cultural beliefs that surround stigma. And one example that we can look at is the belief that mtu amejiua huyo, someone that has died by suicide, huyo apewi ile heshima yake. And in some cases you might find that these people and these deceased people are not normally given a respectful or a rightful send-off. Maybe their burials are held at night. So this is the public stigma that we are supposed to be challenging. Those negative attitudes, the stereotypes, and the discriminatory behaviors that the society has directed towards individuals associated with suicide. Maybe they might have attempted, or the people that have died by suicide, the deceased, and their families or their friends, and things like that. And in this case, you might find that there's the labeling. And I have talked about attention seeker. Alikuwa tu na seek attention. Or yako selfish, alifikiria watu wengine watafeel aje. But we never think of what that person was going through, ndio afikie mahali pa, now I have to quit, now I have to give up in this manner of taking my own life. Then there is the social rejection, still lies under public stigma. So the social rejection, the gossip that comes with it, cultural taboos that silence discussions about suicide. And this, you find that in most cases, they prevent even people from seeking help, from opening up, and things like that. And then we look at suicide attempt survivors. What do they undergo? What is the kind of stigma that they undergo? And these individuals, you'll find that they're subjected to some type of stigma. Why? Because they tried and apparently they survived. So you find that once they survive, the kind of stigma that is subjected to them might even make them attempt again to take their own lives. Why? Because they feel misunderstood. They are blamed for their actions. We don't blame what they were going through. We don't blame the emotional pain they were going through. We start blaming them. We misunderstand them. So you find that in most cases, they end up trying to commit suicide again. And then we look at things like, in that case, you will find also that they struggle with reintegration back into the society. They struggle with reintegration at school. If it's a staff, they struggle with reintegration back to the workplace. Why? Because they feel shameful. They have those guilty feelings. And then we can look at suicide survivors. And suicide survivors, they are those people that have lost someone close to them, a loved one, to suicide. What kind of stigma do they undergo? These individuals who have lost someone to suicide, maybe might be a family, a friend, or a colleague. You will find that they feel blamed for not preventing the death. They feel blamed. Why? Mbona mtu wako alijitoa why? Ulikuwa wapi? Didn't you see the signs? They are normally very much blamed. Social isolation. Unapata watu hata hawataki kuassociate na wao. Sometimes hata utasikia watu akisema huyo maybe ndiye ako na nuksi. They are blamed for these things. And then we look at We look at another thing, reluctance to talk about the loss for fear of judgment. Utapata, they don't even want to talk. Maybe they tried their best to help that person that died by suicide. Lakini they can't open up. Why? They will be judged. They will be blamed. So these are some types of stigma that people undergo. The person, the loved ones, the public stigma that those people receive, or the person that has survived. And then we look at the next slide, the global crisis. How does suicide affect us globally? Or what are the things that people undergo? And we can look at, number one, just as they are outlined there, the economic burden. Suicide and self-harm, they normally impose a significant economic cost globally, affecting the healthcare systems, productivity, families, because you might find that the person who has died by suicide was the breadwinner. So that family has been affected economically. So we can say that suicide is one of the leading, according to those studies that have been done by World Health Organization, it estimates billions of dollars lost annually due to suicide-related productivity decline. So this is a major loss of human potential and productivity. And how are these students affected? How are the staff affected? For the students, it might be due to the tuition pressure, the financial hardships, and fear of unemployed. Then they might push these students to thinking that quitting or giving up through suicide is the only way out. And then we look at the gender disparities. And as I talked about, I talked about males, dying by suicide more than the women. And why is this so? Though as I continue, you will see that females are the ones that attempt suicide more, but males are the ones that die by suicide more. And that is called the gender paradox. So you'll find that males are dying more by suicide. Women just attempt, but in most cases, it never goes through to the last outcome. That is the fatal outcome. So globally, men have been found to die by suicide more frequently than women, though women attempt suicide more often, as I have said. And this is due to the fact that men are less likely to seek help, possibly due to societal pressures, social expectations around masculinity and mental health. And this brings me to ask, tumekuwa tukisemanga, and this is in most backgrounds, and actually this is what we have grown up tukisikianga, ati mwanaume ushane shida zako, hapana, mwanaume ni kukufa kimwanaume. And why do we say, why we have normalized that to an extent, mwanaume akiuliza usaidizi, hapana, we normally like stigmatize them when they ask for help. Why is that so? So this is a narrative we are supposed to start changing, and understand that wanaume pia, they get challenges as much as women get challenges, and they deserve help the same way females deserve assistance. So that is a narrative that we are supposed to change. Mwanaume si kukufa kimwanaume. When you are going through something, make sure you open up. And then we have the working age adults. Working age adults, this will mostly focus on the staff, but I know we have those campus students that are also working as much as they are trying to study. So we have to understand that suicide is a leading cause of death among people aged between 15 and 49. And I'm sure most of the people that I am talking to today are between that age, 15 and 49. Particularly those in high-stress work environments, they are very much exposed and vulnerable to dying by suicide. And this is a contributing factor. Some of the contributing factors, though I will elaborate on them when we come to talking about risk factors, are job insecurities. Maybe you are there, you're almost finishing your degree, and you don't see any chance of you getting employment. And then we have unemployment. We have burnouts. And this is something that is experienced by both the students and the staff. Burnouts. You might get a burnout from overworking, or get a burnout from the academic pressure and academic expectations. Then we have deaths, workplace discrimination, campus bullying. Do you experience bullying? How has it affected you as a person?
And you might find that at the workplaces or in both staff and students are affected by the bullying, workplace harassment, and things like that. So that is something that we are supposed to look at, and look at how we can be able to also change its narrative. And when we look at the geographic distribution, 77% of global suicides normally occur in low and middle income countries, and Kenya is one of those countries. So, and this is according to a study that was also done by the World Health Organization in 2023. And you find that in high income countries, male suicide rates are higher, while in some, female rates are close or higher due to social pressures. So it might vary from one location to the other. And this is due to maybe stigma, poverty, and limited access to mental health care, which normally compounds the risk. And looking at mental health, and I have said we can't look at suicide without talking about mental health. Over 90% of people have died by suicide. At least who have died by suicide have at least one diagnosable mental health condition, whether it was diagnosed or not. And some of these common mental health disorders that I can talk about are the likes of depression, bipolar disorder, substance use disorders, anxiety, and trauma-related disorders. Someone may be carrying childhood traumas or family traumas that end up exacerbating their vulnerability to dying by suicide. And then in this slide, we can look at the cycle of this menace that we call suicide. And I hope by so far you can now hear I'm not using the word committing suicide, because people don't commit suicide. They die by suicide. They died by suicide. The way we can say someone died by cancer, they died by suicide, because it's a crisis. So we can look at human cost and tragedy. And on this slide, I just go fast on it so that we can be able to discuss on other things due to the course of time. So human cost tragedy. Suicide represents a profound human tragedy that normally ends up leading to irreversible loss of life. So how does it affect people? Emotional suffering to the loved ones, even to the people that knew that person. There is emotional suffering. There is grief among the family and the loved ones, the friends and the peers, and things like that. And it has been found that each suicide deeply impacts the lives of at least 6 to 10 close individuals, leaving lasting emotional scars, guilt, and trauma. And because why am I saying that? Why am I saying it is a lasting emotional scar? Because death is not irreversible. It's irreversible. So the pain and the distress of suicide individuals often go unnoticed until it is too late, highlighting the need for timely intervention and empathy. And then we have the impact on communities. What is the impact of suicide on communities? It normally affects the entire communities, schools, workplaces, universities, the neighborhoods, by creating shock, confusion, fear, and things like that, and other emotional instabilities. And it can lead to suicide contention. And what do I mean when I talk about suicide contention? This is whereby the exposure to suicide normally increases the vulnerability among others, especially in tight-knit groups like university settings. So communities normally experience that collective sense of loss and responsibility, which can either fuel trauma or motivate preventive action. So the impact can bring either the negative or the positive. The negative in that it can fuel preventive measures or bring more stigma in our communities. And then we have the public health crisis magnitude. And what do we talk about? What do I mean when I talk about the public health crisis magnitude? According to a research that was also done by the World Health Organization in 2023, suicide is normally recognized globally as a major public health crisis. And as I was starting the presentation, I said that at least 700,000 lives annually are lost through death by suicide. And then we have the economic and societal burden. And I think I've explained it in the previous slide, how the economic is normally impacted. Well, in the case where I talked about the breadwinner dying by suicide, who is going to support that family till it is left in an economical crisis? So this is just beyond the emotional loss, heavy economic costs, and things like that. The productivity is affected. And then we talk about intersection with mental health crisis. And I think I've talked about that enough. So what are we going to do with mental health? Let's try to strengthen the mental health systems, early interventions, and I've talked about the individual level and the institution level so that we can be able to support each other. So early interventions, come up with psychosocial support systems, which will be key to breaking that crisis circle. And then we look at the next slide, where we are looking at the interplay between the mental health and suicide. We have stigma and barriers. Stigma and barriers. And students may avoid seeking counseling due to stigma. For instance, let's say a student is battling depression. Do they have the freedom? Do they feel motivated to go and seek, professional help, to go and seek for a session or two? Or they have fear that they will be judged by their peers. They will be labeled as weak. For the men, wataambiwa, wewe kwa nini mwanaume wa aina gani? Unaenda counseling and things like that, which might lead to this person not seeking help and assistance. And then for a staff, maybe you are struggling with burnout and you are trying to avoid therapy to maintain that strong professional image. This one will now make you will allow the distress to worsen, which might lead to suicidal ideations where you have that brain fog. You can't think clearly. So let's learn to take breaks. If you are overwhelmed, if you have a burnout, seek help. Try to engage in other things that will give you that mental break. And then looking at the environmental factors. Which are these environmental factors that will affect our students, that will affect our staff? Academic failure. We can look at things like financial stress. And I understand that students also experience financial stress. We have the social isolation, which can intensify feelings of hopelessness. And we can look at maybe a final year student who is unable to pay their tuition, who is unable to complete their project. Maybe they may feel trapped, they may feel hopeless. They might have those feelings of unworthy and things like that. Job insecurity, being in a toxic work environment. This can lead to chronic stress, which might result in to someone having suicidal ideations. And then we can look at personal history. And for the students, you might find that a student with a childhood history of maybe abuse or neglect, or a student who has grown up in a family that is subjected to domestic violence, they might struggle with trust, self-worth, self-esteem, which might predispose them to depression and suicidal behaviors under academic stress. So you are juggling with your academic stress and you have other underlying personal issues. And then for the staff, a staff member who maybe previously lost a loved one, endured trauma, e.g. maybe domestic violence, maybe, you might find that they are more vulnerable to suicidal tendencies when facing new emotional crisis. And looking at mental health conditions, I know I have talked about mental health conditions a lot in this session. And as I said, we cannot talk about suicide without looking at mental health conditions like depression, bipolar disorder. And I don't mean that people who have mental health conditions are subjected to committing, to dying by suicide. No, I don't mean that. I mean that they can have other underlying issues, other environmental stressors or other stressors that can exacerbate the chances of them having suicidal ideation, or some a mental health condition that has gone undiagnosed for quite some time. It might lead to someone having those ideations. And then we look at historical trauma. And this is whereby we look at the community, some of the communities. Maybe you have been affected by displacement, or maybe intergenerational poverty. Maybe it may make you internalize hopelessness. You don't see a future. Unaanza kujiuliza, ai, kama wazazi wangu hawaku make it, wazazi wao hawaku make it, what are the chances that I'll make it? So don't compare yourself with other people. Wewe ishi ile yako, tafuta ile yako, and make sure every day you have hope. Try to get hope from one thing or the other. Always have something to be grateful for. And then looking at acute symptoms. These acute symptoms, it can come as a warning sign, sudden withdrawal. And I talked about you not enjoying the things that you used to enjoy, giving away personal items, posting maybe farewell messages online, or things that indicate you have suicidal intentions. And then we can look at the stressors. Which are these stressors and health issues that can lead to one having suicidal ideations? Might be relationship breakups, academic failures, chronic illnesses, maybe to you or your loved one, which can trigger that emotional breakdown, leading to you having suicidal behaviors. Physical illnesses, might be hypertension, might be diabetes, might be, HIV and AIDS, might be cancer, might be epilepsy, which might combine with other stressors like financial stressors, marital stress, can lead to hopelessness and suicide risk, particularly if the person feels unsupported. So once you feel like or realize that another person is undergoing something, always be there to support them and make them feel understood. So let's understand that the interplay between the mental health and suicide, and understand that it involves a cycle where distress, stigma, and lack of support may feed into one another. And then looking at factors contributing suicide risks. Ni vitu gani hizo zitakufanya ujipate umeanza kufikiria, okay, I can quit, I can give up, and the only way out is dying by suicide. What are these things that can exacerbate that, those ideas, those thoughts? And looking at personal and medical factors, that is whereby we can talk about chronic illnesses, as I have said. Maybe you are struggling with low self-esteem, low self-worth. You are struggling with perfectionism. You are struggling with things like imposter syndrome, where you don't feel like you are enough, you are inadequate. Maybe you are feeling that you can't. Unresolved traumas. This can increase the vulnerability to suicide. For instance, maybe an individual, and this is just an example, an individual living with a long-term condition. So let's be there to support each other. If you have a medical issue, a medical condition that you don't feel supported enough, feel free to reach out to the other person. Feel free to reach out to your support system. Feel free to reach out to a professional so that you can be assisted on how to walk this journey. And then we have substance use. And this is, some people normally use it both as a coping mechanism. It can be a coping mechanism, and it can also be a risk factor. When you talk about alcohol, ukikwanga tu na ka stress unakimbililia kauji pale, cannabis, tumbegu pale ndo tu ulichoma, wewe ndo tu unajua pedi. Ni mgani ako na mali safi, ni mgani anauza viforeign kali, and things like that. And I know this is language that we can all understand because it's language that is normally used. Taking of prescribed medication, unakunya mingi ndo feel some type of way. So you will find that unaitumia until the body becomes dependent. Unajikuta na umekuwa addict, you cannot do without. And this can worsen things like depression, which may lead to self-harm or having suicidal ideations, especially during moments of deep sadness or frustration. Una feel frustrated sana. Kitambo ukipiganga hiyo tot moja zinashuka unasikia fiti. But now unakunywa hata mzinga mzima, unakunya mizinga miwili, but you're not feeling anything. So you might feel frustration. Mbona this is something that I used to do na sahi nikifanya I need reduce. And then you find yourself in despair to an extent of committing suicide. And then we have life stressors. And which are these life stressors that we can talk about? And one common one is the financial hardship. Unapata economy iko juu, but pesa haitoshi mahitaji. Job loss. Not having a job security. Wewe unakaanga tu hivi on your marks. Ukijua anytime kazi inaweza isha. Career stagnation. Maybe you have stayed in one position for months, for years, and you don't see any sign of being promoted. For the student, might be academic failure too, or uncertainty about the future. Maybe you are not sure if you'll get a job after you are done with your studies, and things like that.
Thank you.
And
We
then,
need to sum it up. Thank you.
yes.
It's getting interesting, but we need to sum it up in 2 or 3 minutes. Thank you.
Okay, thank you. So these are things that we can look at. And then relationship risk factors being one again of the leading factors. Maybe relationship high work, things have not, working with your partner, a divorce, a separation. These are things that can also exacerbate chances of having suicidal ideations. Then family dynamics, coming from a broken family, and things like that. Then we can look at social factors, and I talked about social isolation, who are bullied, exclusion, lack of sense of belonging. That also can lead to you feeling hopeless and loneliness. And then we can look at environmental factors. What are these environmental factors that can lead to us having those ideations of suicide? Overcrowded or unsafe hostels, toxic work environments, exposure to violence, and things like that. And now the most leading one currently is the media influence. And normally you find that sometimes suicide is portrayed as something, it has been glamorized to some extent in some social media platforms. So ensure that whatever you are feeding yourself from these social media platforms is something that is positive and is going to help you. And what are these warning signs that you can look at? And we normally have the emotional signs, psychological signs, verbal signs, behavioral warning signs, and things like that. And they can come from, expressing hopelessness, extreme sadness, feelings of worthlessness, and things like that. And when you talk of verbal warning signs, we can look at things like talking about wanting to die or killing oneself, expressing feelings of being a burden to other people. And some people might say people would be better off without me, and things like that. Mentioning feelings of hopelessness or feeling trapped, or things like that. And then behavioral warning signs, whereby you might experience your loved one or a close person, or you yourself, you are withdrawing, neglecting personal care. Hauogi anymore, your clothes bado unavaa, tattered clothes, haujali tena about your cleanliness and hygiene. Increased substance use. It has gone from 2 beers, driving fast, self-harm, and things like that. And then also hapo tunaweza ongelea vitu kama mood changes. You are nowadays sad and moody. Those are things that you can look out for. And then how do you respond to an immediate crisis? Ensure that you stay calm. Maintain that composure that will help the other person feel understood, feel that empathy, feel not judged, and things like that. Be an active listener. If someone has expressed feelings of hopelessness, or has given, you have had someone talk about ideas of committing suicide, dying by suicide, make sure you give them that listening ear. Wasikize, listen to them, skiza every detail. Give them a soft landing. Ukimeshamaliza kuwasikiza, don't judge them. Ensure that you have a safe planning of how you're gonna help them. Ikikataa kabisa, now how you're gonna help them. Tafuta professional intervention. Tuko na even free professional guidance zenye ziko. You can call 1199, that is NACADA, and things like that. And then look remind every person that they belong and they are worthy. Thank you very much for the opportunity to share my insight on the topic of suicide. I really appreciate. Thank you so much. Those are our contacts. If you would like to call, we also have a toll-free line, and you can find it in the website. Thank you so much, and I really appreciate.
Wow. Thank you very much. Just remaining at that slide so that people can be capturing, screenshotting the contacts. I know it has been very insightful. All people here can bear me witness that this has been very insightful, making us know that suicide is real, but we have the solution. It is a matter of taking action. It has been a very insightful session. I know time has really run out. Many people here would have reactions. but you just allow me to take from 1 or 2 people before I invite our DVC. Anybody with a reaction, it may not be a question necessarily, maybe a take home that you can just unmute and just say it. I'm just taking from any 2 people. Randomly without choosing. Victorine, who is speaking?
Brian.
Yes, Brian, proceed.
Thank you so much for this public lecture. We are learning a lot because in everyday life, these are some of the challenges we've seen people go through, our relatives, friends, family, even us individuals. Sometimes we reach dead end with life, and you start kind of your mind kind of walks so far away, and it's good at least we know that there are people outside here who are ready to talk, to bring us home and to make us see life positively. It has been an insightful teaching, and I think more of this will also help reduce such kind of suicides and any other negativity that we are facing in the society, be it drugs, be it the suicide that has been talked about, and many other things. Thank you so much for this session.
Sure, thank you. Thank you very much. I believe, just introduce yourself. You are our student. Which program?
I'm Brian Umutieno. I'm a student doing bachelor BML in supply chain.
Thank you very much. That is from the part of the students. Maybe you've taken note of that. Our presenter, I believe, has taken note of those accolades. We really appreciate, and we look forward even to a more detailed session in the near future. Yeah, so time is really running. I would just love to, at this juncture, I bring in our DVC who is here with us, maybe to make her remarks, and invite the VC also to give his remarks as we close. So, Dr. Dominita, you're welcome.
Thank you very much for this wonderful public lecture. And as I was listening now, I was thinking now and looking at the men. I'm sure many men are here. And as being said, yes, the suicidal thoughts almost occur to all the genders. And true as I think it was through a research where you find even if women will try it or attempt, probably either their dosage is not the right one or the means is not the right one. But many men are dying out of this. And it's not even like the people you would think of committing such kind of suicide. We know very senior people have committed suicide, and people would wonder why would such person commit suicide at that level at that age. So I think usually a topic which is very relevant, and as you have put it, is good. You know, sometimes people say, like for women, when you feel you are so stressed, you talk, and you talk, when you talk inakutoka, or you cry inakutoka, but unaona wanaume hata kulia hataki kuongea, naona anachekwa. So I think it's a topic which is really very relevant, and it's good time people get this information is very important, so that people can know the kind of the problem and the challenges they are having. They are not all them alone. There are challenges, they can seek help, and they can be helped, and they can live long, and they can live stress-free kind of life. So thank you very much for that wonderful choice of the topic and also of the trainer. And I think this is really the way the world is. This is an area, because even of the financial stress, because of the drugs, as you have said, because of the infidelity, which is usually happening, and sometimes you find it becomes a shock even to our family, to our families. And you find when the partner behaves otherwise, then you find you did it. And then when it turns otherwise, you find you are now even the one wanting to kill yourself. So why? So I think it's very timely, and we thank God that we are having this kind of the public lectures so that we build and we also understand better how to cope with the situation, because the economic and the family and everything is becoming difficult. And usually something people never thought, they are stressed until they realize they are stressed. When yes, we had another one. When you go to bed and you cannot sleep, the sleep is not coming. What is this that making you not to sleep? So thank you so much for the department, and also for good choice of the topics. And I want to believe at least you usually ask an evaluation, what other topic from the members they would want to be taken through, so that at least we give members the kind of the topic which they really want discuss. Thank you, Makasanda.
You can invite the VC with that.
Thank you. I'm already there. Thank you, Dr. Dominita. I think you have picked the words I had for our presenter. So thank you very much, Esther Munguti, for the great talk you have given us this evening. Thank you all the participants, our students and our colleagues who have looked in. At least we have managed to learn. And I think, as Dr. Dominita has mentioned, and also the presenter, this issue we were discussing today is of paramount importance to us as human beings. And indeed, even as a university, we have had tragic events whereby some of our students, unfortunately, have ended up committing suicide. So it is not a theory. It is actually a mental illness which deserves to be treated accordingly. I think there are available remedial actions which can be taken when somebody is in that depression mood where they may end up contemplating suicide. And importantly, is being your brother's keeper. I think somebody, Brian, was reminding Dr. Dominita that these days, as men, we also cry. I saw Brian, somebody was reminding.
Yes, Mwalimu. Nowadays, women cry to ease the tension. I wanted to remind our doctor.
To release, yes. So as men also, we know how to also diffuse. Without much ado, because I know our classes are starting shortly, I am humbled and I am happy, and I look forward for another interaction. Have a great evening, all of us, until we meet next time in another conversation.